Ma'am, should we start?
Yes, Masha, we can. It's 7, no?
Yes. Um, so, good evening, everybody. It gives me great pleasure to welcome you all to the third session of the Transdisciplinary Perspectives on Health lecture series, hosted by the School of Psychological Sciences, Christ deemed to be University, Central Campus, Bangalore, in collaboration with wove, the student-led wellbeing clinic. I'd now like to call upon Dr. Aishwarya to introduce the session and our esteemed speaker for the day, Dr. Priya Treesa, Additional Professor, Department of Psychiatric Social Work, NIMHANS, Bangalore.
Thank you, Masha. Uh, Good evening, ma'am. Dr. Priya Treesa Thomas Hall, PhD in Psychiatric Social Work from NIMHANS. Currently, she is working as an additional professor in the department rendering psychosocial care services, and she is involved in clinical, teaching, and research activities. In NIMHANS, she essentially concentrates her clinical expertise in social work and social science research with the person suffering from various neurological illness and their families. She works extensively with the neurodegenerative disorders, mainly motor neuron disease. Dr. Priya is passionate about compassionate care and building micro skills among healthcare professionals. She is dedicated to the development of neuro-palliative care services that can be scaled up to different settings in India. Today's topic of lecture series, Compassionate Communities in Palliative Care. Welcome, ma'am, to take this session.
Thank you. Thank you very much, Aishwarya, and thanks, Manju, um, for inviting me here and for this opportunity. You can see some quite familiar names. I hope that familiar names. So I'm hoping that senior people are also there. So what I'm going to do for the next maybe 40 minutes, I'm not going to have a major lecture in the sense that I do have some slides, but what I also want, because this is not a mandatory lecture, all of you have signed up for this program because you are interested in reflecting about compassion. That's what I understand. Reflecting about what makes lives better for people who are going through life-limiting diseases. That is why all of us are here, and we are exploring different ways of approaching it through all these sessions. So from that approach, I hope that all of you will reflect on all these concepts that we are talking about, and I also hope that you will use the chat, or you can unmute and kind of comment on, because mm, the concept of compassion, and I'm sure all the topics that you have been addressing in these sessions are not something that are textbook based alone, though there are a lot of conceptual frameworks and theoretical frameworks. All of us interpret it in our own way. Everything in life we interpret in our own lens, but then it is very important in the context of care, because care is not just self-care is also equally important, but care is also other people, as in we are talking about developing systems of care that kind of takes care of everyone, without in general in healthcare there is no equality. I'm sure all of you will be kind of, if you think about it, is there equality in healthcare that we talk about? Is there equality in access that we talk about? Is there equality in the kind of care and continuum of care that people can kind of count upon? Are these things equal in our world? Is there are no answers to this. I'm not asking you to say yes or no, but then these are things that once in a while, we all of us are very complacent in our lives. We are happy that we are at least healthy, and we can get up in the morning and we have a place to go. We have something worthwhile to do and come back home, and we have a home to come back to. We have people who care about us. We are reasonably healthy, that we can take care of ourselves and do our own basic activities. We can be productively engaged in something that we like doing. We have choices that choices are something that's very important again, because when we do not have choices, that is when we feel life has no meaning. It's not about anything else. It's about there may be a lot of problems, but then at least we know how we do have choices about how to manage this. So these are all things that we are all every day taking for granted. And when it is challenged by the presence of a disease, diseases are something that happens to other people in general. We don't unless and until it happens to us, the person who is the protagonist, it is difficult to understand what another person is going through. But we talk about even in care, all of us, including me, we are see what works for me, able to really connect. That is what ethnographic studies and all about. All of you may be familiar with ethnography as a research method, right? Like you be there, and all those things are very important. So having said all these things, when we are challenged by things that are happening around us, like COVID was a major challenge. All of us, it's something that is very fresh in our mind, and then we know that a pandemic, a teeny weeny virus, can really shake the world that we know about it. And pandemic brought a lot of opportunities and platforms for these kind of discussion. In fact, compassionate communities also became a major uh, point of discussion in the context of how COVID affected the social connectedness of people, the care connections of people. So we have that very fresh example in our mind that talks about how the things that we take for granted can change in just a matter of few hours and days and months, and we look for a new normal. So that is how kind of care systems also evolve. We begin with a particular approach, and then we over a period of time think that okay, this is not the way, and something challenges it, and we modify and go forward. And that is that has been true for many care systems. And but something that has always been core for all care systems is the compassion that we talk about, all of us talk about. And that is where I will begin. I am just going to share my slides. Manju is my student. Okay, for all of you who are who are Manju students, so I must say that looking at her face here is like, I know that the smile in her face is that she has listened to all these stories so many times. I keep iterating this. I give a lot of bhashans to my students throughout. So even now, I keep saying the same thing. So the smile in her face says that she has heard all this before. Right. So is this full screen visible?
Yes, ma'am. Yes, ma'am. It is.
Yes. So this is where we are going to begin the concept, and we will think uh, for each one of us, um, what does compassion mean to all of us? Because I believe it is from individual that we reach out to the world, global. So it is, unless and until we are clear about what we are talking about, it is easy to read textbooks, but in there is a lot of things that will be lost in translation if we are not reflecting on what we read and what we keep saying. So compassion, care, and palliative care, and all these are words that we keep on talking about. Social networks, empathy, there are very good examples all over that talks about, we keep using it so much that it has become cliche. But and we use it so much that we really do not know what it means to us. So once in a while, compassion is very common. All of us know what compassion is. It is good to just pause and reflect about what does compassion mean to all of us. And then we will just have a kind of discussion discussion about how this concept of compassionate communities have been evolving, and then a little bit of thought about all of us belong to a collectivistic society, as in the Southeast Asian communities are always collectivistic. So what do we talk about compassionate communities in this context? These are some of the things to look for. It will not probably be in the same context because I'm also in the same order, because what I also would like is for all of you to engage and comment so that we can even take a different direction from what we have now planned, so that if it takes us somewhere else. Right. So what is compassion for me is the question which I would all of you to think about. And please, if you can unmute and in fact, I do not have that many slides. So it will be good if we can spend time on reflection and thinking about how do we connect our own individual innermost understanding about each of these concepts to building communities that are caring for our people. So can one or two people unmute and kind of discuss about what does compassion mean for each one of us, or you can use the chat also. Shall I call out names? I can see names, okay? Since I don't know any of you, it will be a very non-partial calling out, except Aishwarya, because she already spoke. Who would like to just share your views on what does compassion mean to you? Yes,
Yeah.
Hemlata.
Compassion equals kindness for me, showing a lot of kindness towards other human beings.
Kindness, yes. Kindness to self or kindness to others?
Both. Yeah, both.
Yes, both. Chat. Manju, can you manage the chat? I can't see everything
Sure,
together.
sure, ma'am. Sure, ma'am.
Can you
Sanjana is
read out?
saying, yeah, sure, ma'am. 1 minute. Padma Lakshmi is saying that compassion is about equal treatment to all fellow human beings.
Yes, equality concept. Thank you for bringing that. Yes,
Maitri ma'am saying that it's empathy.
it is
Empathy.
empathy.
Compassion.
It is
Empathy.
empathy.
Masha is saying it's being kind.
Being kind.
Yeah.
Yes. Being
Sanjana
kind.
say, yeah.
Yes. Yeah, go ahead. Go ahead.
Sanjana says that compassion is a combination of kindness and being helpful.
Kindness and being helpful.
Meera ma'am is saying it's kindness and understanding.
Right.
For Anupam, it's concern and motivation. Joanne says that compassion means being thoughtful about others. And
Yes.
for Devishri, it's being with someone who needs support, show them that they're not alone.
Yes.
Shruti says that it's feeling for someone who's suffering and having a desire to provide relief.
Yes. So all of us. That's it, right?
Last one more, ma'am.
Okay. Okay.
Simran is here to say that it's recognizing suffering and being helpful.
Yes.
And Dr. Arun
So
says that it's motivation to act to alleviate it.
motivation to act
To
to
alleviate.
alleviate suffering. Right.
Yeah.
Right. So all of us kind of recognize that compassion has a component of being thoughtful, as in which originates within us, but reaches out to others, which are who are it could be in need, people who are in need, but then it's also a general attitude, right? It is about you can universally be compassionate. It could, it is also an attribute in the sense which who also then again can compassion be taught? What do you think, all of you? Because all these definitions that you have now, definition, not just definition, all this understanding about compassion that we spoke about, encompasses compassion. So it is what is compassion to one person is kindness and empathy. Another person is being there for another person. So it has a component of self originating from us and also reaching out to others around us. So it has all these dimensions. So is this an innate trait or is it something that we train ourselves in? Can somebody unmute and tell because I can't see the chat? It's about, so I'm talking about compassion as a, is it a teachable skill? Is it a skill that can be acquired versus something that we innately, some people are more compassionate than others or something like that. Are we born with it? Or
Uh,
how do we develop it? Yes, please go ahead. Can you
uh,
introduce yourself and tell?
yes, I'm Meera from the Department of Psychology.
Okay,
Um,
go
so
ahead, Meera.
I, yeah, so I think compassion is mostly, I think it's modeled more than taught. That's what I have learned because I think I don't think it can be taught very explicitly. But of course, I think one it could be innate. Well, I'm not very sure of it, but personally, I feel it is modeled, and that's how you learn. Like you experience that and you know the value of it and therefore you kind of do that and
Yes.
maybe from the people whom you maybe it could be your parents or at home, I don't know, so that's how I could think about it.
Yes. So your approach is that, or your submission is that this is something that we develop through socialization, as in like we observe others around us and we. Yes.
Yes, I mean that's how you I feel that is something one of the
No, no,
best
that
ways
is.
to learn. Yeah.
So there are some of us who feel that it's a personality trait. You are born
Mm-hmm.
compassionate, but there are also people, as in schools of thought, that say that compassion can be taught as a skill. In many of these communication skills workshops, they talk about we talk about empathy and all those things are something that can be taught by step, right? Even compassion can be taught, is one of our senior professors keep saying all the time. But then I think it is for me, and I'm sure all of you will have your own viewpoints. It's a combination of both. We have something within us that makes us sensitive to those around us. And over a period of time, by observing other people who have been kind, and who we learn the value of being kind and compassionate, and then so there is a tipping point also. We need to decide to learn from others. It will not be just that those who are around me are compassionate, so I also will become so. My point here is yes, communities, once we translate compassion to behavioral part, because when we initially spoke about the definition of interpretation of compassion, there has also been the dimensions of compassion that we speak about: being there for other people, supporting other people, and motivation to act to alleviate suffering. These are all action part, right? Practice. So it begins within us. It begins with an attitude. It begins with a warmth. It begins as a feeling, and then we move on to translate this into actions, which is where communities become very important. This is my favorite quotation. This may not be correct, Manju. I hope you remember this. The Margaret Mead was an anthropologist, and they say that this actually may not be correct. That may not be attributed to Margaret Mead. But then I found this quotation to be very apt in the context of compassionate communities. Margaret Mead had done a lot of work in understanding primitive communities, the cultural, that as an anthropologist, she was very interested in understanding how communities kind of evolve and become more civilized over a period of time. So she's done a lot of participant observation, ethnography kind of work. And later on, after she published her findings, there are a lot of lecture series that she used to give. And then one of the questions that she faced at one of those lectures were that what is one of the early sign of civilization in ancient times. So she has been attributed to say that a femur that has been broken and then healed is a sign of. So the student expected that Mead will say that it could be wheels. We are all familiar with our history lessons, wherein we say that the first sign of our children, we teach, right? We say that as wheel is the first sign, sign of development and civilization. When human beings started using wheel, they became more able to transport and things, right? So there are several things that we pick up, that how do we say that a community has evolved and become much better civilized. So we expect a lot of answers, but then Mead said that it is not any of those tangible things. It is about when you have a femur, which is a thigh bone that has been broken and then healed. So as you can imagine, the thigh bone is very important for transportation, moving around, mobility. If a human being breaks thigh bone, it is very important. It is very difficult for, it is impossible for that person to move around. So in the animal kingdom, if you break a leg, you die, and you cannot run away, because survival of the fittest, and animals and all those things are a challenge, and you cannot run away from danger. So, and you cannot hunt for food. So this means that a person who has broken the leg and have been laid off is not going to survive your meat for other animals. So it is from that context, if a person with broken femur has healed, so if you can find the evidence that the femur has healed, that means that another person or another animal or another human being someone has taken time to stay with this person and has been feeding him, taking care of him, protecting him from wild animals or whatever. And that is a simple. So that person who had broken femur had survived and healed, and then was able to get back to their normal life, means that there was someone who was caring for him. So when that kind of an evidence could be elicited or could be taken out from any digging up and fossils and things like that, that is when we can say that that community has been civilized. So she goes on. So this there has been subsequently a lot of discussions about this passage, and then people have been saying that it is also about compassion. When compassion is the core of civilization, and when people look at each other as something beyond that, my survival and our to move on to our survival, that is when kind of societies and the doing things together is also a selfish kind of motivation from in terms of survival, right? When people pack together, animals also stay together. They are together because they survive, and it is a force greater than being alone. So that is one thing. That is how packs are together. That is how all these big animals stay together in the jungle and things like that. That is one way of community building. But then that doesn't take care of the ill and disabled within that group. So when we can find that a particular community has kind of cared for its ill and it's broken, that is when we can say that we have started the concept of compassion and things like that. So we will, the topic that was given to me is about palliative care and compassionate communities. But I would like to bring your notice to the concept of care in general, not only in life-limiting end-of-life kind of thing, though there are a lot of work that has been happening in end-of-life care and palliative care. But I would, from the discussion that we have been having, I'm also encouraging all of you to think about the concept of care in general. It could be disability, it could be elderly care, it could be any kind of care that a person. It could be even child care. When there are both parents working, there is a child, and who will look after that child? Those kind of. There are a lot of across the lifespan. There are a lot of care situations that we encounter. Palliative care stands out because it has not been much supported care of the dying, was never been so much supported till Dame Cicely Saunders started talking about it as a hospice movement. So over a period of time, it also is a circumscribed group. People who are going to die, cancer palliative care or non-oncology palliative care. These are all very clear trajectories there, and we can talk about their needs. We can talk about how they can be supported in a kind of boundaried kind of a community. That is why compassionate communities became more and more a term in the context of palliative care. But the basic premise is that, so we will again and again come back to palliative care, but then this is applicable to any kind of care where that should happen in communities. Mental illness and care, for example, severe mental illness and how communities care for people who are mentally ill is also equally a compassionate based kind of approach that we should talk about. If from a historical point of view, if you talk about, we are looking at St. Christopher Hospice. All of us are familiar with it in 1967. So it is from that active work that has happened through St. Christopher Hospice that palliative care has become increasingly professionalized. Till then, people were always dying. People are now also dying. But then the quality of death that we talk about has been always varied, and the extent to which we pay attention to death and the process of dying has also been much different. And it is only with the advent of hospice movement that the concept of suffering and relieving suffering while you are going through death has become more and more, gaining attention, and then became increasingly professionalized and things like that. But then it has all the downside of that is also that it became institutionalized. Going to say, meaning to say that you go into an institution where suffering is relieved, or there are SOPs to take care of pain and symptoms and things like that. So that is the change that has happened after hospice movement. Over and again, these are cycles, right? Like there are nothing, and then something happens, and then in a particular way it happens, and then people who are inside or even outside begin to think that this is not the right way to do it, and we should look at something else. And that is how the inequality or iniquity of end of life care for those, because originally it was oncology palliative care, and then only cancer used to get palliative care support, and only people who can access hospice became, the all of us are still finding a lot of inequalities. As I said in the beginning also, uh, care is actually very much unequal. So when these thoughts came up, people within the system itself started talking about how difficult it is to address the needs of people who have terminal illness from a very institutionalized point of view, and then the multiple domains that require support has to have a different viewpoint. That is how the compassionate communities discussions became more and more. So this is a kind of public health approach to palliative care. And Kelleher is a person, I'm sure some of you may have heard about him. He has actually done a lot of work in the context of developing communities that provide care. And in palliative care, how do we build systems that can care for their own, dying and death and dying and things like that. From the time he has published this book, he has done multiple, furthermore, a lot more refinement of this process, and several other stakeholders have taken up this to the extent that, many of us are familiar this picture in several contexts, right? The circles of care that we talk about. We also are familiar with this in the public health point of view, from preventive, promotive, and things like that. We also familiar from a social support point of view, the system, Bronson-Benner's approach. All these are, all these theories kind of look at person within systems, circles, and support and things like that. So the circles of care is something that has come into the foray as some, like when we are talking about how do we empower communities to look after their own elderly, their own dying. how do we, so when we have a diagnosis that that means that things are all going downhill, and we have so much of needs that keep evolving. There are so much of losses that are happening, which has again rippling effect. It's not just physical and symptom management, it is also psychological, spiritual, and everything. So how do we kind of make sure there is a system of care that goes beyond an institution or a hospital or even a hospice? Is the public health concept wherein the person with illness is embedded in all these systems, and each of the systems, how do we engage with them to provide an opportunity to address the so ultimately, if we are able to frame this, it also means that irrespective of, we are also probably we are familiar with the social determinants, right? Like social determinants, intersectionality. Again, Manju, you will recognize it. We talk so much about intersectionality, irrespective of, across age, people have different needs, people have different access. A woman who is having an illness would have differential access to care, differential facilities, differential care and support as compared to a man in the same age group, in the same diagnosis also. So this differential accesses due to age, socioeconomic status, due to availability of people to care for, due to many other things are, and even the diagnosis, the nature of illness itself is a differential concept. A person who has cancer in the fourth stage would have a different kind of trajectory and different kind of care needs and support systems requirement as compared to a person with dementia who will have 10 years of survival, and then will have a kind of spiraling of losses that will happen. So this differential understanding can be addressed much better if we are able to build a circle of care for a person who is suffering from. So it's not just a diagnosis based approach, it's not just an institution based approach, it is also how do we look at an individual's circles and try to see to what extent this can be enhanced. So compassionate communities, once it started kind of becoming a major point of conversation, it became, it caught the fancy of a lot of people, and were a lot of compassionate community initiatives that came up in, you will find compassionate community, UK, Canada, Australia, all these are, very structured and very systematized approach to building compassionate communities are there. But the core remains that it is an approach that begins with hospital, home, and we get hospital diagnosis and things like that. We will go back to the community, and the circles of care that we spoke about will come together to support the person who is going through this difficulty till end of life. And so it is also important that the person with illness is not just the person, it is also the carer, the family, so who will be left behind once once this phase of a person's life is over, who will go through all those bereavement challenges, which requires even more support at times than when the person was alive. So building a system and having enough policies to ensure that these, so beginning with the micro system of a person and family, to advocating for having a place to die or having a better care during end of life, all these are encompassed in this context of compassionate communities. But at the very micro level, it's also about people who are willing to spend their time, people who are willing to engage. From this context, you will also find a lot of initiatives like cafes, death cafes, for example, and there are dementia cafes, people who are where people with cognitive impairment are the only people who are serving, and that kind of a lot of initiatives are there across globally in different communities. But it is very sporadic in the sense that it depends so much on the community that you belong to. I'm also quite fond of Maslow's hierarchy. So when we are looking at all of you are familiar with Maslow's hierarchy, I know. So the sustenance needs are very important. So we should also provide for sustenance needs in terms of, they should have the basic needs should be met. Even when we are dying, a person who is dying will be at some hierarchy, some step in the hierarchy. So uh, I may be dying, I do not have anything to eat. I may be dying, I may have so much of bank balance, but I will anyway die. So my approach, so the needs from this angle are very different. Whether when I have sufficient resources to look after my own needs and sufficient resources to engage someone to care for me, that is one scenario. But then it is also important so the concept of equality that we were talking about, the public health approach, is also that even if I do not have a bank balance, and if I am struggling to meet my sustenance needs, and I am developing cancer, I'm going to die with cancer, and versus a person who is so with a lot of resources, but he is also going to die with cancer. So making sure that both of them will be able to be supported through the circles of care, and they will have entirely different circles of care. So compassionate communities are about looking at, also you will be familiar with those. I don't have that picture. We have this a very common picture that we show about equity, right, where children with different heights are standing on different height boxes to watch something beyond a wall. So meaning to say that a person who is having short stature will require a bigger box to stand on, as compared to a person who is having a bigger, longer, taller fellow may not even require a box. They just need a small stool. So the equity concept comes into play here also, making sure the everybody who is having some need is are cared for by the concept of compassionate community. So these are some of the examples. If as I said, Canada has done excellent work in developing conceptual models, and where they talk about how individual, family, community, and culture should go hand in hand. There are a lot of roots for, you need to collaborate, you need to have a vision, you need to have a leadership, you need to also have infrastructure necessary, and some natural helping. So many of these communities that we are talking about, compassionate communities, have systems of youth groups or systems of senior citizens forum, which are otherwise also existing as a network, which they will engage in the process of supporting, championing the cause of elderly, end of life care and things like that. So all these essential components of engaging, empowering community, and building partnerships and promoting participation, all these things, when it comes together, still it takes a lot of time. It is a process of phase by phase. A community will develop towards taking care of their own dying and aging. But the first step is always to have a conscious awareness about the need for such a sharing of responsibilities, or such a it's about sensitization and having the courage to come out and speak about. Many of you may be familiar with the death literacy festival that recently happened last weekend in Bangalore for the first time, wherein people from different walks of life came together to talk about death and what it means to them. So we don't really like to talk about death. We don't really, we are very uncomfortable. So that is, we will come back to the collectivistic society concept a little later. But here we are talking about communities that are more individualistic, wherein so Canada is an example of that, wherein people come together with existing social networks, and through a process of capacity building, try to develop a compassionate community. So closer to home, Taipei is also a leader in developing compassionate communities, about how do we so here they also talk about what are some of the practical. This is an article which anyway I will share all these materials. Those who are interested in exploring this more, this type A experience is also talking about some practical things, that how do they build communities through roundtable meetings and making sure environment is supporting the circle of care and things like that. So it is the core values and how do they translate it into a practical strategy. So ultimately compassionate communities are targeting better end of life care for everyone, whoever, not just people who are able to access it and things like that. So we encourage the care at home, in the community, not just in hospitals. But ultimately, the core value, dignity, is again something that all of us are familiar with in the context of palliative care. Respecting dignity of the person and the culture that they belong to, and naturally, that happens best in their own milieu, in their own cultural context that we are talking about, and involving all these networks. And of course the practical things of awareness, everything is very important. This actually will help to address the gaps that we have been talking about in terms of equality. And also you may be familiar with the dementia friendly communities. Dementia friendly communities are a concept that we are trying to work towards from a public health point of view for dementia care. Again, when a person, especially dementia, it is different from cancer, as I said earlier, in the sense that the person can move around very often, but then the cognitive impairment makes it so difficult for him to be in control of his environment. So he will wander out, and wandering is one of the most challenging issues that the people with the caregivers face. The person do not have an insight, so he does not probably, we do not know how much he feels the distress. But then caregivers struggle to meet him, to track the person who is wandering and things like that. So one example I generally like to give is that, generally when there is a dementia at home, it becomes one family struggle, as in that family just struggle left and right, and so much of struggle is there to look after, to meet the needs of a person who is going through dementia. And it happens at different levels. Sometimes the door will be opened, he will go out, and then the family will be searching throughout and things like that. But if we have communities that are that are able to see every elderly, every person with dementia as their own, like it used to happen in our rural communities earlier, wherein everybody knows everyone. So if there is wandering, even if the person is not able to find the way back, there will be other people who will be able to find, locate him and take him back and things like that. So it has changed with urbanization. But then if we are able to build small communities that are kind of able to do this, that also reduces caregiver burden. It becomes the challenge of everyone else. So it's not that, dementia is an example, but then dementia is something that all of us have more chance of dying from dementia than dying from cancer. So it is something that all of us who do not as yet have dementia have a responsibility to care for people who currently have dementia. So it is a kind of giving back kind of a thing. Hopefully that when we have developed, that we have dementia, there will be other people to care for us. At least by that time we will not know what is happening. So it is only the pain that families go through for this. So having said all these things, it's about building all these systems that will work towards having systems that care, and also reducing one person's burden, and encouraging all these discussions about, when now there are a lot more discussions about advanced care planning and living will, and how do I want to die, and all those things. How do I not want to die, for that matter, do not resuscitate, and all those things, that also. So if we are able to have this kind of discussions, we are looking at a scenario wherein we have the freedom to speak about each of these advanced care directives and all those things, because ultimately when I see patient who is in the end of not end, advanced dementia care, families struggle so much to know what the patient, what is best to, so because every family wants to do the best for their patient. There are very few families who are really, we will hear about this families who are neglecting their elderly. We'll hear about people who are not being taken care well and things like that, burden for that matter, we hear that. But for each person who is going through all those negative experience, there are 10 more who are taken care of really well, whom we do not really hear about also. But having all this, when we see them in clinic, one of the things that the families always kind of lament is that if they knew what the person, because now the person is not able to give their preference, now he cannot speak, he cannot access his thought process. So the families again and again feel that if we knew that the person wanted, if he had a preference, we would have really loved to do it, as in we should have asked him before. All those things are something that families now come and say. But then when we are well, we do not encourage this discussion. So in the dining room table, death and my last wishes are not something that we would encourage, right? I myself find it difficult, having spoken so much. And when children are there, when I tell them that if I have a problem, please do not put me on ventilator, please let me die. And that is not something that we generally encourage as a dining room dining table conversation. So a shift from that towards a little more acceptance of birth and death are the only things that are certain in a person's life. We are born and we die at some point. How we die and how long it is before we die, all those things we do not know. What are the things that happen in between also, we do not know. But we do know that we will die at some point. And it is strange that we don't really want to talk about it because of whatever reasons. So a compassionate community approach is something that over a period of time will bring a shift to this difficulty in conversations, and better awareness, and maybe work around the stigma, and all those things are something that we will look at. Right, I have been talking for a long time, so now I hope all of you are not sleeping. Can you think about this concept? How does it apply in our, Indian society? Has a lot of characteristics, not just Indian, any Southeast Asian society has a lot of unique characteristics, which are probably not, not as very similar to in the Western context. There are some very deep-rooted traits in Indian communities that are lending itself to compassion very well. There are some things that are acting as a barrier also. So can all of you think again, and this is my last point, and before we probably open up for discussion, I just want to come back to this concept that we started with the individual and compassion and interpretation, and now we move on to, as a society, how do we approach compassion? How do we see compassion? And how do we we spoke about how Canada and all those compassion community concept is about utilizing networks to care for the elderly in the community. So, and they are doing it as a structured development process. Whereas in our community, are we doing it? Are you all familiar with any of such examples? How we can work towards it and things like so. Again, a point for discussion. With that, we will. So, and yeah, before we go, I just wanted to also connect to that. These are compassion, and the activities related to related to compassion are very culturally rooted. So culture acts as a template for all these processes. How do we translate our I may be compassionate, but then I can only take up culturally appropriate processes to show my compassion. I cannot go to another person's family and just like that give compassion, and I may get hit also. So culturally appropriate, and culture acts as a template for all these things to play out. So compassion is also culturally rooted. All of us are familiar with compassion as not as an abstract concept, as something, as we mentioned in the beginning discussion also, as something that we observe other people doing and learning. And how do we make it structured is also a cultural process. So with that, yeah, that is a second. This is about how have you encountered, or what do you think about compassionate community concept in our society? We call ourselves as collectivistic in the sense that we are high on family bonds, we are high on several other things that brings people together. Values, everything is different. We are also high on a lot of religious, not I wouldn't use the term spiritual. We are very high on religious approaches to looking after our distress and taking care of distress and things like that, care component for that matter. So these are some of our traits as Indian community. Have you Indian society, have you, so in this background, I'm just inviting all of you to think about how does compassionate community concept translate in our society. Can somebody just unmute and kind of share your thoughts? Are you all sleeping?
Ma'am Shreya has raised her hands. Maybe
Yes,
she.
Shreya. Please go ahead.
Uh, this is not very something theoretical or anything. It's just from my experience. So when you are asking about compassionate communities and end of life care in our society, it just came to my mind that once I remember my grandmother asking me, "What do you think about old age homes?" She asked me about an opinion, but I know it's not just opinion. She was expecting me to say some or the other thing, and this is something that I've seen a lot. Like, it's not very openly discussed, but in our society there is, since it's also collectivistic and there is a lot of importance in family bonds, there is certain kind of expectations that come with care or end of life care from your children, from like parents and children, and like generationally that works out. So it's always it's not very something that's understood as a system, as a community of professionals, of family, of different people working together. It's something that's always becomes like a
Very
debate,
personal.
something personal, and also something that's, will you rather take care of me yourself, or will you want to have professional support? Like, there are parents who think that it's better for their children to take them to professional support and not take too much burden. But that also is something that is a rebellious opinion from a parent's point of view also, in, if situated in our society. So this is something that's that I've seen around me, people discussing it, but it's always very heated and not
Yes.
like openly discussed as much.
Yeah, thank you for raising it, Shreya. I think that is a very important point that when we are talking about compassionate communities also. So it is not just about old age homes. So that is why compassionate communities became a very very what do you call, very a place to go kind of a thing, because compassionate communities are about communities where people will be cared for, not shifting to any kind of, or not getting admitted to any institution. So the basic ethos is that people, wherever they are living, even when they are going through all these challenges, they continue there, with the support from the social networks around, or the even the professional networks around, but then home care and people home, nurses visiting and things like that. All those things are the kind of way forward. But you are right in the sense that it takes so much of a shift in mindset, and people are now there are a lot more, and whether we like it or not, we are a society in transition. We do say so much collectivistic, but there are also so much of individualistic creeping in, and it is not a bad thing. There is change is the only constant thing in any way, in any circumstance. So we cannot always say that we had, but one factor that probably is important here is that earlier we used to have a lot more religiously mediated care systems and care rituals and things like that, which made it like it has to be done like that. The problem with rituals is that if it is not done in that way, people gets guilty, and then it has, it challenges the belief system so much. Whereas compassionate communities kind of disengages from so much of expectations and bonds and all those things that you mentioned, and also these rituals that we are associating with, and the guilt associated, because it is about, without guilt, whether you are able to do this in your own surroundings, in your own environment, is the concept that they are talking about. So there are a lot of merits for it, uh, but it also takes a lot of courage of conviction to change. As we have been discussing, it is also, it's easy to talk about all these things when it is applicable to another person. When it is coming to my old age, my own family, my own caregiving situations, it becomes more difficult to kind of connect and take decisions and things like that. But having said all these things, a reduction of this a reduction of um, this stigma around death, and all this care arrangements, all those things should happen a little earlier. So in this context, I also sometimes it's something that we have been discussing, Manju, is also about the need for having these kind of conversations from early age. Maybe school death education is something that I've been very interested in, but then maybe school is a little too early. College is something all of you who are now here, not you Hassan, because you are already specialized, but then people who are in the undergraduates and maybe junior college and things like that, wherein whether they can also start having this conversation, is something that over a period of time makes societies a little more a little more sensitive and little more willing to take up other this thing, is something that we look at. So the last point is, I wanted to thanks Shreya for that discussion. I just wanted to end by, these are the take home things, but then I just want to end this discussion by inviting all of us to think about, there are structured compassionate communities, but then again, connecting with this discussion which Shreya initiated, we are we are surrounded by people around us who are very near and loved ones, who are going through these phases. We ourselves may have to go through this phase a little, some years down the lane. We are facing a changing caregiving environment, changing socio-demographic scenario, changing social norms also. And ultimately, we don't want to be a burden for anybody, all of us. Nobody wants to be a burden for anyone. That is one thing that all patients uniformly feel. And one of the causes for distress is that I have become a burden for my loved one. So everybody comes from that space where they would like to be, not be a burden. But then that is a little later. Um, from this scenario and from this changing scenario, what is it that we can, so compassionate communities as a structured system may be a long way ahead for us in our society. Though Kerala, as you are familiar with, may have a lot of neighborhood network facilities, but then that also is not a community. It is about volunteer. It's high on volunteerism, and volunteer groups are taking up care giving in their own homes, which is also one way of compassionate community. But then, generally compassionate communities are about everybody in a community engaging in the care of people who are there in the community who require care. So it may actually take a long time for us to reach there, but we still have a lot of things that we can do for each of us in our own space, in our own circle, which can turn into a circle of care. So I would leave you with this, maybe not having much discussion, but then if a few of you would like to share, that's also welcome. But then what I would like to leave you with is to reflect on what is it that each of us can do on every day that we are alive, to make our life meaningful, to build communities that care for those around us. How can we become part of circle of care? So we are providing care, so we should also, so here we are thinking about providing care for others. We should also think that at a later point we are going to require this care. So I mean, earlier, for all of us who are old here, as compared to all of you who are quite young, early in your career and life, threshold of your life, but it is a conscious decision for all of us to engage with this process. So it will be good if all of us can reflect a little bit about how do I contribute, how can I you're all taking part in this kind of lecture series. That itself is a one step through which we are kind of engaging with this conversation dialogues, and we are already engaging with the compassionate compassion building process. But then in our own immediate spheres, how do we take small steps, that thoughtful steps that can kind of contribute towards building communities, is something that I would leave you with. This is my last slide, just to say that a sustainable public health approach to serious illnesses, it's a compassionate communities, is a response to the need for a sustainable approach to serious illness. And thank you very much for patient listening. I am happy to kind of listen to all of you.
Thank you, ma'am, for your enlightening thought, to your talk. You have really explained to us about how compassion comes from within us and is translated into action when we engage in the societies and the communities around us. So we will now open the floor to questions. You can
There
either
was one
raise your
hand. I
hand.
saw one hand.
Yes, I think there's even a question in the chat box. Let me just ask the question.
I can't see. Where is the chat box? Like, okay, if you can
Uh,
read out
On the bottom right corner, ma'am, it will be there.
those three dots, but I'm not having those.
Maybe Masha, you can read it, Masha.
I'll read out the question, ma'am.
Go ahead.
Hello, ma'am. Thank you for really this fascinating presentation. This question is coming from
Yes,
Pooja.
I got the. I opened. Okay, read. No, I was happy
Yes,
that
ma'am. I was hoping that you could share your views on the increasing privatization of healthcare and what implications it could have for palliative care. It occurred to me that there could be a possible conflict between profit making and patient centered care. Thank you.
Yeah, thanks, Pooja. I think it's a very relevant. So the question that we started off is also about equality in access towards healthcare, right? So one challenge that has happened in healthcare, us in education. So again, I kept mentioning that social change is only constant. Change is only constant that keeps coming up again and again. So earlier, service based service based areas like education, for example, and healthcare, all these used to be more service oriented, and over a period of time it shifted the tone towards being a little more commercialized. Education also, all of you will be familiar with how education has become so commercialized. Same thing has happened in healthcare, and it is more just like in education, parents are willing to spend any amount of money to educate their children, and according to the whatever their needs and all those things. In healthcare, people's distress is being capitalized. So people are so distressed, so they will even sell their land and go to healthcare, or go to this hospital, that hospital, and things like that. So it is all the more reason for us to bring in this attitude of care. It is I wouldn't say that it is wrong, because care is very expensive. Unless and until we have, you know, a lot of public health fund, a lot of government supported, or not just government, any kind of public health, this thing, it is difficult to meet the caregiving expenses of any scenario. The problem happens when the profit becomes the only, only criteria for getting admitted. There are a lot of healthcare facilities wherein only if you can pay 50,000 in a month that you will get care. So it has become increasingly commercialized, and we have been. So I work in a public health facility, government hospital. So we have been very, what do you call, very consciously trying to find scenarios, or find solutions to that are equitable, so to speak. So one way we have been trying to do this is to support home based care, so people to support caregivers who are providing care and linking them with all kinds of networks and all kinds of resources available, NGOs available. It's an upskill task, because there is never going to be a scenario wherein all the resources, the demand is always going to be more than the resources available, especially when we are looking at a graying population and more healthcare needs, and more we are also looking at our socio-demographic changes, right? The young population are now equal to elderly, but then we are rapidly moving towards having a highly, older graying kind of population and lesser young people. We need young productive people to provide the care. So when we are looking at that kind of a transition, we need to think out of box, trying to see, in spite of all this commercialization, in spite of high cost associated with care, how do we ensure that everybody who requires care gets the care? But I'm also very often I keep, worrying that when we are, the systems now are increasing the distance between haves and have-nots. The people who have access will be able to get better care and will have better this thing. People who do not have will go down, down, down. So the age-old challenge of resource allocation and resource scarcity and versus demand, difficulty in meeting it is something that keeps coming up again and again. In the middle of all these scenarios, whether we can find our compassion is something that, there are 10 different ways of doing the same thing. You can be part of a public healthcare system, you can be part of a highly paid profitable profit making kind of healthcare system also. You can be just a family member of a person who is caring for a loved one who is going through this struggle. So there are so many roles that we play in our life, whether professionally, and there are, in compassion, I think it is also a core within us. It is not something that you can switch on and off. Like you are going for work, and in workplace you will be compassionate, and you come back home and then you will become not compassionate. You switch off your compassion. That is probably not something that possible. That is possible. It is something that is core part of us, and we, in different doses or in different combinations, according to the scenario, according to the place that we work, place we are kind of doing our whatever we are doing, we try to bring in consciously the concept of compassion into whatever we do, but also be compassionate to self compassion is very important. It is not that we can change the world will have its own flow, but we can always make the tiny weeny difference there by being a little more compassionate than we were in the previous situation to now. That conscious decision, choice, is something that probably all of us can do in spite of all the challenges that are happening around us. I hope that answers the question, Pooja.
Is there any other question in among our audience? There
I
was
saw
someone
one
who
hand.
raised their hand, yes, but I think they've put it down.
Now that has gone down. That's okay.
Yeah. Okay, before we move on to another question, I would just like to bring to the participants' notice that the feedback link has been shared in the chat box. please make sure that you fill it up because this was very important for getting the certificates as well. And we would also like to hear your feedback on the session. Thank you so
How
much.
will you all? No, no. I just want before we leave, I just want to iterate that all of us, once we finish this webinar, uh, I would encourage all of you to take out your diaries or whatever, paper and pen, and try to just first of all reflect on what we discussed now, because it is not a textbook discussion. It is something that closely connects with all of us, not just community building process, just being compassionate also. Just a few thoughts that you have about whatever we discussed now. And the last question that I mentioned about how do we work towards being a little more, how do we work towards contributing to to build, contributing towards building communities that care, communities that are compassionate. Just spend some time trying to reflect on this process, and I'm sure that you will be able to come back to it again and again in your as you go forward in your course and professional career. All the best.
Yeah.
I think
Thank
we
you,
are.
ma'am. Thank you so much, ma'am, for your wonderful, insightful, and thought-provoking lecture. I now call upon Dr. Manjusha Warrior to propose the vote of thanks.
Thank you, Masha. Ma'am, yeah, a formal vote of thanks to you. It's always a pleasure to listen to my guide, my mentor. And today, we all got a chance, along with my students and my colleagues, we got a chance to listen to you, ma'am, and to learn from you. And we are so grateful for this opportunity. Thank you so much, ma'am. And if you have observed, ma'am has a signature style wherein she facilitates discussion. It'll be like an interweaving of many familiar stories which she would have once shared with us, asked her students. Plus, there'll be something new every time. So I got something very new today as well about the community, compassionate communities. So that is my take home for today. And this was a truly enriching, just not just for saying, but then really I mean it when I say this, because there were a lot of things which ma'am keeps saying us, but there will be something new every time. So that combination is always amazing. And as Meera ma'am first told, compassion is not something to be like taught but modeled, right? So I go with that. I always support what Meera ma'am was saying in this context, wherein ma'am, we are grateful that you are the model for us to follow that, because you model us what compassionate care is, and we have learned from that. And I hope that this discussion has given an opportunity for my students as well as my colleagues to think in those lines as well as reflect on those lines. Thank you so much, ma'am, for spending your time as well as sharing your wisdom so generously with us. Thank you so much.
Thank you. No, one last word. I'm so sorry. I just wanted to tell the kids that we will be listening to a lot of information. Now we are in so much of digital age that every day we get so many reels and so many forwards and so much of information out there. We are living in an information overload world. But then when we go through our life daily activities, there are some things that creates a spark in us. Spark, again, Manju, this is, you'll be familiar with the spark. Spark is something that I am always something that I always want to tell the students, that it's not that everybody perceives things in the same way. All of you who are there, the 20 people who are here, will perceive compassion in a different way. Whatever I have been talking about will be interpreted in a different way. But then in whatever we have been discussing, something that kind of creates a spark in you, your heart, in your heart, you can feel that, yes, this is what I want to do with my life. That is something that, that is what education is all about. Then if one person can get a spark from this, that is what I would consider my work done, because it is a spark that you will keep, and when occasions come, it will kind of flare up, when you will find yourself in a lot of different scenarios, then that spark will keep you going. And life is very difficult, there are a lot of challenges in this life, but then it is a spark that will keep us going, striving for doing better. So I hope that I wish all of you a life that wherein you will find your spark in different scenarios that you go and engage, and all the very best to all your future endeavors. Thank
Thank you
you.
so much, ma'am. for your session, which was very, very insightful, as I previously mentioned. And I'm sure we've all taken back something that will hold
Spark.
on to us a lot. Yes, a spark, as you said. So I would like to once again thank everybody for joining the call. And thank you so much to everyone for your participation and your support. I would like to take this opportunity to thank Dr. Sureka Chukkali, Dean of School of Psychological Sciences, for her constant encouragement and guidance. I extend my appreciation and gratitude to Dr. Sudesh NT, our head of department, and for his support and leadership. A heartfelt thank you also to Dr. Manjusha Warrior and Dr. Patrick Jude, our session coordinators, for their dedicated efforts in making this event possible. My sincere gratitude also to the organizing team and all the faculty members, students, and practitioners who joined us today and contributed to making this session a success. Thank you all for joining the call today. We look forward to seeing you for the next upcoming session on September 5th as we continue to talk more about health in general. Thank you all for joining and have a wonderful evening.
Thank you.
Thank you, ma'am. Thank you, everyone. Bye. Good night.